So one of the common conditions we see in our office is a crossbite, and we see it pretty commonly in kids that come in. A lot of times their dentist will take a look at it and see it. Sometimes a kid will notice that their bite feels a little bit off and parents will have us come in. And sometimes kids don't even know it at all that they have a crossbite. So the crossbite is where the top jaw generally is narrower than the lower jaw. And so when your upper jaw is narrower than the lower jaw, you kind of are in this position where the teeth aren't lined up where they should be. Okay, so a couple of the reasons that we like to treat that as early as possible, usually as early as 7 years old. So the reason we would like to treat that early is because when kids are growing and their bite's not lined up and they're shifting to try to find how their teeth fit together, they can cause their jaw to grow asymmetrically. And so we don't want their jaw to grow asymmetrically, we want it to grow together. And a lot of times what we'll need to do in those situations is use an expander to help kind of just widen the upper jaw to make it so that it matches the lower jaw and everything fits together. So that way there's no shifting at all when kids are biting down and chewing on their food. For the most part, we can really correct this within 6 months of treatment. Sometimes we talk about different sort of crossbites that might take a little bit longer. If we're talking about a crossbite of the back teeth versus the front teeth, sometimes this appliance doesn't always work to correct a crossbite that we have in the front. So sometimes kids will come in where they have a crossbite in their front teeth, and that's where we might need to add some braces in addition to this to help kind of widen the jaw and bring the teeth into position where they're fitting together.